Hey guys, welcome back, and today we are going to discuss about risk for chronic self-esteem. So first we will see what is the meaning of low self-esteem. Low self-esteem is an emotionally painful condition that can cause physical damage as well. It's especially worrying when it's chronic, lasting a long time, and has severe impact on life. It requires active management and support from professionals as well as family and friends to bring about effective change. According to Nanda nursing diagnosis, what is low self-esteem means? The definition of NANDA. What is NANDA? North American Nursing Diagnosis Association. Nursing diagnosis for risk for chronic low self-esteem is risk for disease or decrease in individual sense of worth, manifesting as feeling of inferiority, decreasing confidence in ability, diminishing optimism towards achieving goals or overcoming obstacles or excessive social withdrawal. So we will see the nursing diagnosis. Before that, we can see some of the fact. Chronic low self-esteem can lead to an increased risk of developing certain mental health conditions like depression, anxiety, eating disorder, and addiction. So low self-esteem can make you worthless or hopeless. Okay, so that can leads to or that can develop certain mental health conditions like depression. Chronic self-esteem can worsen or leads to depression. Anxiety, low self-esteem can trigger anxiety. Eating disorder, low self-esteem or low confidence level can worsen the symptoms of eating disorder. Might be bulimia or anorexia. Then it can increase the chance of getting addicted to any kind of substances like alcohol, drugs, etc. Now we will see the nursing diagnosis. There is a list of nursing diagnosis you can see. So each one is up to you, like depend upon the condition of your patient, you can formulate or you can develop the nursing diagnosis. So I'll just read this. Risk for chronic low self-esteem related to history of trauma or abuse or chronic illness or disability or dysfunctional family dynamics or social isolation or lack of support or negative self-talk and self-perception or persistent mental health issues or long-term unemployment or financial difficulties or body image disturbances or substance abuse. So chronic low self-esteem can develop because of this. So these are all the etiology. Okay, as evidence to by okay, expression of doubt in self-worth or as evidenced by preoccupation with past failure or withdrawal from social interaction or verbalization of fear or rejection of inadequacy, hesitancy to engage in new activities or avoidance of eye contact or assertive behavior or over reliance on external validation. So while writing, you know that you have to add both related to and as evidence to be. So you can write like risk for chronic low self-esteem related to history of trauma or abuse as evidenced by expression of doubt in self-worth. And one more thing, keep it in your mind that since this is a risk for diagnosis, it focuses on potential signs rather than actual evidences as the issue has not yet occurred. Okay. Now we will see a sample nursing diagnosis. So while writing, you have to formulate your diagnosis like this. Risk for chronic low self-esteem related to history of trauma or abuse as evidenced by withdrawal from social interaction. So you have to formulate your diagnosis like this is the pattern of the formulating Nanda nursing diagnosis. Now we will see the care plan. So while writing the care plan, please add all these columns: assessment, diagnosis, planning, rational, implementation, and evaluation. So in assessment column, you have to write what? You have to write both subjective data and objective data. In subjective data, what your patient says about their condition. In objective data, what you have observed from the patient. So here the subjective data is the patient says that he or feel like they are not good enough and hopeless. So what they are saying about their situation, that you have to write under subjective data. Objective data means what you have observed from the situation. Or what's the patient status? So patient avoids making eye contact and shows reluctance or hopelessness or restlessness, that you can write. Then diagnosis is depend upon the condition of your patient. Okay. Then goal. The patient will express an understanding of factors contributing to low self-esteem, or the patient will demonstrate coping mechanisms to handle negative self-perception. Okay, that is a goal. Then you can start with your planning, rational and implementation. Planning, write in present tense and Rational, you can start with 2, and implementation in past tense. So the first planning is do history collection and mental status examination. Do history collection and mental status examination. That is the first planning for all kind of nursing diagnosis. For what? What is the rationale? To understand the present situation. In implementation, you can write done history collection and mental status examination. Next planning is assess self-esteem and body image. Rationale to identify the baseline self-esteem level and plan interventions. Implementation assessed by doing open communication and asking questions. Next, promote positive self-talk and cognitive restructuring to reduce the feeling of isolation and help identifying the negative thoughts. Promoted positive self-talk by making the patient to engage in group activities. Now we'll see the next planning. Encourage the patient to verbalize the feeling. For what? To explore the feeling and emotions. Encourage the patient to verbalize the feeling and start to do therapeutic communication with the patient. Then next planning. Support the patient to involve in activities that foster success. For what? To boost self-confidence. Supported and given activities to the patient. Give health education on mindfulness to regain the mental health and confidence. Given health education on yoga and meditation. Encourage social interaction with supportive individual to reinforce self-worth and provide emotional support. Encourage the patient to interact with other staff and other service. Okay. Then refer for counseling to analyze the root cause of the problem. Referred for counseling. So in this way, you have to write your nursing plan, and at last you have to write the evaluation. In evaluation, you have to write the result. The patient reports feeling better about themselves and their abilities, or the patient shows reduced signs of negative self-talk or behavior. So here in subjective data, you have seen that a negative self-talk, right? I'm hopeless. I'm not good enough. So in evaluation, what you are writing, the patient shows reduced signs of negative self-talk or coping behavior. Okay, or that, what is that? That is a coping mechanism, right? So like this, you have to write your nursing diagnosis for chronic low self-esteem nursing diagnosis. Hope you understand, guys. Thank you so much. Next day or next week with another nursing diagnosis and care plan. Thank you, guys. Bye.